everybody. This is Kerry Shearer again for the National Public Health Information Coalition. I'm here in Anaheim, California at the Public Health Preparedness Summit. And let me tell you, things really got hopping today. We've got 1,500 attendees here, and things kicked off this morning with a great session. We had a panel on stage who went through the management of the Joplin, Missouri tornado, and they had some amazing things to say. I even had a chance to sit down and talk with one of the physicians who helped get things back on track there after the main hospital was wiped out by the tornado.
It literally looked like a nuclear bomb had gone off. You know, houses were totally leveled, trees were stripped of their limbs and their bark was gone. Cars were pulverized. They looked like they'd been sandblasted. The paint was gone, every window broken out. And then once you start making it into Joplin, you see that the hospital was the only structure in the path that was still standing. I had to walk the last mile through the debris to get there. And the staff had done an extraordinary job of evacuating the building through broken stairwells. Every window was busted out of the hospital. Gas lines, medical gases were leaking, oxygen was leaking, natural gas lines were leaking. It was filling up the building. Luckily, the generators that should kick on did not, because the liquid oxygen cylinders next to those in the gas lines were broken. It was a godsend in hindsight. I think what made the difference is that we've unfortunately been battle tested, and we had a chance to work out some of the bugs. Had this been the first big disaster, I'm certain things probably wouldn't have gone as well as they did. But because we had the opportunity to test those and tweak them over a 10-year period, it made all the difference in the world. Preparedness is everything.
Social media was again the focus of some of the breakouts today, including this one, which was so packed they actually had to bring in additional chairs while it was underway.
Opportunities of social media, public safety and crisis information, public engagement to a remarkable extent. Warnings and alerts, very quick, very effective. The reverse 911 now calling you up on the telephone to let you know that there's severe weather in your neighborhood, as well as requests for assistance can be very rapid, locating family, situational awareness and damage estimates. There's talk of the USGS of now using cell phones and having those cell phones call in, take photographs of damaged buildings and damages after earthquakes and send them there. So there's many of the opportunities, and these go on and on. These are only just a short list. But there are also challenges of social media as well. Number one is there's a lack of awareness, and I'm glad to see so many people in this room raise their hand when we're talking about social media. And obviously the topic here being, obviously this is a selected group, because I can tell you that many of the times when we talk to people about social media, there is somewhat of a cutoff among government people. But many people in lower socioeconomic statuses here in the United States and around the world actually use social media, use smartphones almost exclusively. I found that in Africa, whenever I was barely able to get a hold of a cell phone in the United States, many people in the villages of Africa, I was working in Tanzania and Kenya, had cell phones and were using them routinely. What they didn't have was landlines because it was too expensive to string those up. And so we see that this lack of awareness, we think is going away, but certainly there's a lack of awareness that still has to be addressed in what are the uses, what are the challenges, and so on.
There's a lot more to come from the Public Health Preparedness Summit, including on Thursday. There's going to be a general session on how the CDC worked with the producers of Contagion, the Hollywood movie that came out in the fall, and I think that's going to be fascinating. Also, once again, remember that I'm recording sit-down interviews with a number of people about how communications and social media and everything works together in a disaster and in a crisis response. So you'll be seeing that in the very near future on the NIFIC website. For the National Public Health Information Coalition, from the Public Health Preparedness Summit in Anaheim, California, I'm Kerry Shearer.